to NSC 416 Clinical Posting in Mental Health and Psychiatry. My name is Elugbaru Deborah Oluwadamilola. I'll be taking you through the course. I want to encourage you to sit back and watch. Take your pen and papers and jot down what you'll be needing. And also, you can as well go to your LMS at any time to pick up materials and read for your own understanding. I wish you best of luck. In clinical posting NSC 416, the course is designed in such a way to make the undergraduate nursing students of the university have an all-round exposure of various units of the psychiatric institution, to involve in observing how patient clerking are done through assessment procedures, technique used in clerking patients, mental status examination, and clinical diagnosis of the patients using the NIC and NOC tools, to ensure students participate in administration of medications, ECT, and other psychotherapeutic interventions in managing of psychiatric patients. And by the end of this clinical posting, you should be able to identify clients with major and minor psychiatric mental health disorders by recognizing the various signs and symptoms, and also know the classification of various mental health challenges through diagnostic evaluation, know various effects of the pharmacological and psychotherapeutic intervention on patients. Also be able to develop nursing care plans and be able to use the nursing care plans in the treatment of the patient. First, we want you to be able to identify the patient with minor and major mental illness. As taught in class, mental illness include many different conditions that vary in degree of severity, ranging from mild to moderate and to severe. So there are two broad categories that can be used to describe these conditions. We have the any mental illness, and this comprises of both the minor mental illness and the major mental illness. That's any mental illness. But we can also say minor mental illness. And these minor mental illness are those illnesses that does not have contact with reality. And we have a serious mental illness, which can also be known as the major mental illness. So when we talk about the any mental illness, it encompasses all the recognized mental illness that we know, whereas the serious mental illness is a smaller and the subset of any mental illness. And you can say the serious one are the major one. But in any mental illness, you can get the minor and also you can have the major. So when we talk about the minor mental illness, know that from the class, we classify it to minor and major mental illness. And this can also, minor can also be referred to as neurosis. And this is a class of functional mental disorders which involves distress but neither delusions or hallucinations. You know that when we talk about the symptoms of major mental illness, we discuss that they have hallucinations, delusions, catatonia, and disorganized thoughts. So in minor mental illness, there won't be delusions, there won't be hallucinations in minor mental illness, but it is a functional mental disorders that could involve distress. So neurosis may be called psychoneurosis or neurotic disorder. So neurosis may be defined, which is also minor mental illness, as poor ability to adapt to one's environment and inability to change one's life patterns and to develop a richer, more complex, satisfying personality. So when we talk about neurosis or minor mental illness, it is the poor ability to adapt to one's environment. So when you see a neurotic patient, that patient will have inability to change one's life patterns and to develop a richer, more complex, satisfying personality. Fear of dying, terror, and so on. So we have them, and this continues as all other types of minor mental illness. Another type is what we call the obsessive compulsive disorder signs and symptoms. And here we have the recurrent and persistent thoughts, impulses or images that are intrusive and inappropriate that cause anxiety or distress. So the symptoms of this OCD is anxiety, distress, recurrent and persistent, or the thoughts that keeps on coming, and the patient will be telling you that is just coming, the thought has been coming. So also we have the thought impulses or images that are not simply excessive worries about problems in real life. They are not simply excessive worries. The thoughts, the impulses, and the images will be coming. Then another symptoms here is repetitive behavior, such as washing over. Because there is a recurrent and persistent thought, then there will be repetitive behavior in response to the recurrent and persistent thoughts. I hope you understand that. Then we have any other typical behavior, which could be as a result of mental acts that the patient carries out in order to reduce that distress or anxiety. So there will be distress, there will be anxiety. There are lots of them as discussed in class, and you have to apply them in identification of patients with minor mental illness. We have the major mental illness, and this is also known as serious mental illness, and they have major signs and symptoms, which are hallucination, and this can be auditory, tactile, visual, gustatory, according to the sense at which there is hallucination. We have delusions, we have catatonia, which could be waxy flexibility or motionless, and we have thought disorder. So when you see all of these signs and symptoms, then you should be able to identify that this is a major mental illness. Also, we have the diagnostic classification. In the practical, for you to be able to understand, you must be able to know how to classify, how to diagnose the patient, how to diagnose them. And we have two of them. We have the ICD and we have the DSM classification of mental illness. According to DSM, which is Diagnostic and Statistical Manual of Mental Disorders, it has 5 categories, and it has axis 1 to axis 5. In axis 1, we say it is clinical disorders, that is all mental disorders except personality disorder and mental retardation. And in axis 2, we have personality disorder and mental. So when you see a patient with personality disorder and mental retardation, you know this is axis 2. Axis 3, we have general medical conditions, but these general medical conditions must be connected to a mental disorder, and this is how you are going to diagnose. So when you see a general medical condition that is connected to mental disorder, then you know there is this is a classification, axis 3. Then axis 4 is psychosocial and environmental problems. For example, limited social network. So when there is a problem with psychosocial and environmental problem, then it is axis 4. Then axis 5 talks about the global assessment of functioning, the psychological, social, and job-related causes, factors of mental illness is being assessed under global assessment of functioning. Then talking about the ICD, we have the F0 to F99, and F0 it has 999 interval between them. You see F0 to F9, F10 to F19, F20. So that is how it is being classified. So F0 to F9 is organic, including symptomatic mental disorders, and there is an acronym that we use to connote it, which is called osmonumbambu. Osmonumbambu is OOMSMNBADMDU. Osmonumbambu. So with this, you'll be able to understand how to classify them. So it is F0 to F99, and there we have organic, including symptomatic mental and behavioral disorders, schizophrenia, mood affective disorders, and neurotic behavioral syndromes, and so on. And the last one, which is unspecified, the behavioral and emotional is still there. We have the last one, which is unspecified mental disorders. So when you begin to see symptoms, when they fall into all of these categories, you will be able to know how to diagnose them. Then another thing you need to know is mental health status assessment. In mental health status assessment, mental health professionals do not only rely on intrusive physical examination techniques like palpation and auscultation. Instead, they focus on being and expert observers, keenly noting both the positive and negative findings to gain insight to an individual cognitive, emotional, and behavioral functioning. So we have the tools for mental health assessment and status examination. We have the mental status exam, which is called MSE, and this is typically involve a structured interview and systematic behavioral observations from patients. So there are domains that are covered in every mental status exam, which aim to tackle the problem of that individual and be able to have an insight to what is wrong with the individual. So what are the key principles in approaching mental status exam? We have: you welcome and establish comfort, you maintain privacy and respect, you document, and you document. Those are the three key, the key that you have to: you welcome, you give you maintain rapport, you establish rapport, and you document. So what are those things that you want to evaluate? The first thing to evaluate is appearance. And when you're observing the patient's appearance, you want to check the general look of the patient. Is the patient kept? Is the patient unkept? Is the patient appearance, is the patient clothing, is it clean? Is it neat? Is there no posture disproportion? You want to check the general appearance of the patient, the cleanliness and hygiene, the posture and gait, and so on. And the common language you use here is: it is clean, shaven, neat, unshaven, and so on. Also, you see we have different of them, and it has been explain using this illustration. The appearance, you see, the attitude, the behavior. And there, the appearance, you want to look for grooming, eye contact. The behavior, you want to look for speech, motor behavior, and so on. So look at mood and affects. You see mood, subjective; affect, objective. So when we talk about mood, it is subjective. Affect, it is objective. What the patient, then you want to know the perceptual disturbances, the hallucination. How is the patient having hallucination of any senses? You want to know that, you note it down. Thought form and thought content, cognition, and so on is what you need to check in mental health assessment. So, so far so good. You have been able to get how to identify the mental health, the psychiatric patients, minor and major, and how you can identify them. So also you check the behavior, you check the common descriptors, and so on. You check the behavior and the common descriptors are tense, decreased activity, and so on. So this will be done to all the keynote for MSc. So you have been taught how to diagnose. You should be able to diagnose them and know the category of the diagnosis you are going to give, and be able to identify such patient. Thank you for your patience. See you next class.